Now, patients seeking medical care in Nairobi County public hospitals continue to face frustration as doctors maintain their industrial action now in its 28th day. Most healthcare facilities have been forced to hire doctors on a locum basis in an effort to keep essential services running. The prolonged strike has been compounded by a nationwide clinical officers strike, and Helen Aura begins our bulletin with that report.
The empty wards at Mbagathi Sub-County Hospital paint a stark picture of the impact of the ongoing doctors' strike in Nairobi County. Doors that once remained open to patients are now padlocked, a clear sign of a strained public healthcare system under pressure. Solidarity. Doctors affiliated to the Kenya Medical Practitioners and Dentists Union in Nairobi County accuse the county administration of lacking goodwill to resolve the dispute.
Promotions. Imagine with the current inflation, a consultant or an MO staying in the same job group for the last 7 years, for the last 10 years without being promoted. How do they expect these healthcares to work? So us as doctors, we stayed back at home because we want to reduce the risk of exposing our family and our friends without salary and without insurance. At Dagoretti Sub-County Hospital, Mutwini, patients continue to trickle in, but operations remain slow as the strike takes its toll.
Kuna line. So hadi sasa inafaa kuwa home, tumekuwa hapa bado. So services ziko slow.
When I was on the queue one day, I wanted to see the doctor. The number I was given, I was told that you can even go home, cook lunch and come back. So I was imagining all that time, but at least they are moving, but it's slow.
Hospital management says measures have been put in place to manage the crisis.
We have engaged more locum doctors, so our theaters are 100% functioning 24 hours. We have also put in locum anesthetist, clinical officer anesthetist, just to ensure that mwananchi receives the service.
The strike now compounds the impact of an ongoing clinical workers' strike, further stretching already limited resources. But Nairobi County Chief Officer for Health Tom Nyakaba has denied the assertions by KMPDU.
Despite the fact that the administration has sat down, agreed with them a raft of issues, and to date 99% of the issues have already been resolved. The only issue which is remaining and is beyond the county government is the issue of promotions. And we have agreed with them that in the previous supplementary budget that was submitted to the county assembly, we agreed together that we raise 524 million to ensure that we solve all pending staff promotions. Unfortunately, that budget was not passed.
Nyakaba has also put the doctors on notice should they continue with the industrial action after a meeting between the parties scheduled for this Friday.
And we are continuously urging the unions to stop the antics and go back to work. But as a county, we have committed that if they are decided that their workstation is outside the workstation, then we will recruit other care workers to take care of the patients, because that's our clear mandate as the county government. Once they finish with their antics, then we'll come and continue with them if we have to.
With public hospitals operating below capacity and referral hospitals overwhelmed, pressure is now mounting on both parties to return to the negotiating table to avert a possible healthcare crisis. Helen Aura, NTV.